We will get started. Oh, we're so excited. It is Mental Health Month. May is a time to bring awareness to our thoughts, emotions, feelings, everything that's going on the inside. And so, what better way to do that than to have a workshop with Catherine Van Tassel, who is a behavioral health consultant and also the director of GBS Benefits, which is a fabulous partner to us. So, we're so excited for today. We have a couple of workshops going on this month, and this is the one that's kickstarting us. And so, I want to introduce you to Catherine and let you know a little bit about her very accomplished background. So let me tell you about it. Catherine Van Tassel holds a dual master's degree in both social work and physician assistant studies from the University of Utah. She is a licensed clinical social worker and board certified physician assistant specializing in mental health and lifestyle medicine. She has extensive experience in diverse clinical environments, including both inpatient and outpatient settings, that has helped her develop a well-rounded clinical expertise. She's also a certified personal trainer and holds a nutrition level 1 coach certification. Catherine co-teaches the psychiatry course for physician assistant students at the University of Utah and practices medicine at Mora Medical, focusing on disease prevention and reversal through lifestyle medicine. And she currently serves as the behavioral health director for GBS, where she consults with clients on their employee mental health needs, provides mental health trainings like the one today, and including mental health first aid. She also advises policy changes and implements effective mental health solutions. And she is also certified in integrative medicine from University of Arizona and completing plant-based nutrition, evidence-based optimal nutrition certificates from Cornell and through Harvard School of Public Health. Catherine's expertise has been featured in numerous podcasts, articles, seminars, where she has shared insights on plant-based nutrition, mood disorders, addiction, and lifestyle medicine. That is a fabulous background and shows how much passion you have for this field. So we are so lucky to have you today, especially during Mental Health Month, because we know how busy you are. So welcome, Catherine.
Thanks for having me, Sadie. I am excited. This is my Christmas Mental Health Awareness Month. So thank you for all of you guys that took time to be here. And hopefully we can, focus on our brains year round, and then this just be the highlight in May. So we'll dive right in to be respectful of everybody's time. What are we going to chat about today? So this is meant to kind of be this overarching theme about mental health and what the landscape looks like today. But one thing I want to emphasize, and I always emphasize this when I'm talking with people, is that we all have brains. So just like having a heart, having lungs, worrying about heart health or cardiovascular fitness, brain health kind of gets put on the back burner. I think sometimes we don't focus on brain health unless we're thinking about, do I have a diagnosis of major depressive disorder or generalized anxiety disorder? However, really we should be thinking, I just need to prioritize my brain health like I do my heart. So think about if you go see a cardiologist, they tell you, eat well, do cardiovascular exercise, pulmonology, don't smoke, exercise. But we need to focus more on brains because they impact not only our mental health, but our physical health as well. So we'll talk about what some of that looks like. And then how do we recognize mental health challenges in ourselves, in our coworkers, in others, so that we can not diagnose or treat, but we can help get appropriate resources, know how to speak to that, appropriately communicate with somebody, and not having this fear that we are going to make it worse. And then what resources are out there to help somebody. Oops. There we go. Okay, so I like this statement from the World Health Organization. that states mental health is a state of well-being in which the individual realizes his or her own potential, can cope with normal stresses of life, can make productivity, can work productively and fruitfully, and is able to make a contribution to his or her own community. So the reason why I like this is because we're just talking about overall, everybody has stress. That is okay. Stress isn't bad. It's that when we have unmediated stress, that can lead to mental health conditions. That can lead to other things as well, but we're focusing on mental health as well. It can make us disengage from our work, from our community, from things that are important to us, and feel like we don't have purpose. So when we're thinking about mental health, this is just how do we show up in everyday life where we have a purposeful life where we are feeling happy, healthy, and whole. So what does it look like today in terms of our mental health? Well, I don't think that this is going to come to a surprise to anyone because we are talking about it more. We're having more awareness around mental health, which is fantastic. But we're also seeing that our mental health is continuing to decline. And we most certainly saw that during the pandemic. However, this has been happening since really the researchers are saying in the 80s and 90s that we've started to see this steady, consistent decline in our mental health as a nation. And we're also seeing it impact our children. And we're seeing levels of suicidal ideation, self-harm, anxiety, and depression increase in youth like we've never seen before. So it's really relevant and important to talk about this. So what we see is 1 in 6 youth experience a mental health disorder each year, and 1 in 5 US adults experience a mental illness each year. Now, the thing I want to say about this is that these are reported diagnosed conditions. So again, somebody can be struggling with their mental health, but not either A, have the resources to get help or seek out help for whatever reason that may be, stigma, lack of ability to do that, feeling like, oh, something shouldn't be wrong with me. I don't need care in this area. So these numbers are likely much lower than what they are in reality. And then those that have a mental health condition, sadly, will see a lot of self-prescribed treatment in terms of substances. So there's a really high comorbidity of US adults with mental illness also having a substance use disorder. So feeling very anxious or depressed and maybe drinking more than one should or is recommended for our health. And I don't think that this list is a surprise to anybody, right? I mean, maybe you identify with 1, 2, 3, or the entire list of what stressors can be out there in the world for us. Our lives have really changed over the past couple of decades. And it's not that we hadn't had stress before, but our stresses are different now. And so really being aware of what people are experiencing and how this may impact your mental health is really important. But thinking about people have health concerns, or we have these constant devices that are notifying us, alarming, beeping. I mean, really our minds don't ever get some quiet time because even if somebody's not trying to get our attention, we now have developed this habit to always pick up a device and distract ourselves with something. And we know that this is creating issues in terms of our brain health. We may have relationship conflicts, and that's not to say that we have relationships that are bad. That could be we want to spend more time in our relationships, but don't have enough time to do that. Or we have family conflicts, demanding social life, or lack of community. So there's a lot coming at us, and this is where we see it impacting us. It's, not unreasonable that we're noticing stress on the mind and the body. So when we look at us from head to toe, what happens when we have unmediated stress? So the one thing I wanted to focus on is that it's not that stress is bad. we want stress. Stress is actually good for the body. It's when we don't utilize our tools or self-care or resources and that stress becomes unmediated, we can see the impact literally from head to toe affecting each of our organ systems. And we know that 70% of primary care visits are related to chronic stress. So what does that look like? Well, when we're talking about mental health, we see worsening anxiety, worsening depression, lack of concentration. So kind of this idea like, I can't focus on anything, or I reread the same thing, or I can't stay on task. I have brain fog. We see physical manifestations of this and headaches, dizziness. We can just become more reactive. So I'm sure everyone here, or the majority of people, have experienced this within themselves or others, that things that wouldn't typically upset you or kind of would like just roll off your back during times of stress. So think you're undernourished or underslept or over scheduled, where everything kind of just becomes more tense and anxious. I joke that when my husband loads the dishwasher, it's only full to him when there's like 3 layers of dishes on each rack. And that's like, okay, not all the dishes are going to get that clean, but this is not something to like put any energy into. Say I came in with sleep, I had a full schedule, I had a lot of meetings that I had to attend. That something that would never have bothered me before, I might react to. And this can be anything, being short-tempered with a coworker, with our friends, with our family. We just, our tolerance level becomes so much less. And then we see this impacting our GI system. This is because we are in this fight or flight. And when we're in fight or flight, our GI system turns off. We decrease salivation. We get stomach upset. So you might feel like, oh, I got to go to the bathroom. I have a bad stomach. We can get pain and ulcers, reflux. We can overeat or undereat, so leading to weight gain or weight loss. Our immune system actually gets impacted when we have chronic stress. So this leads to illness and higher levels of inflammation. When we're in that fight or flight, our heart rate increases, because again, this is our body's emergency system. It's feeling like it needs to protect us. I need to pump more blood out to the muscles because we need to be protective. So we get high blood pressure, high cholesterol, increasing our risk of cardiovascular disease. And then those that are planning a family, in the middle of having a family, we know that we get decreased hormone production, and that can decrease fertility. So again, when we're not paying attention to our brain, whether or not we have a mental health condition, when we're not mediating that stress, it's really impactful. And you think, how is that even possible? Well, it's this physiological response that our bodies have to stress, and that has been very protective of us over hundreds of years. Because if we were ever in danger, think about when we were hunter-gatherers, our body would turn on this stress system to run from that danger. So that means my eyes dilate and I start breathing faster. I turn off my digestion because I don't need to digest my food if I'm going to be somebody else's food. Your blood pressure, your blood pressure increases because you got to dilate your vessels. Our muscles become tense. So you just see this complete change in your response to stress. But this happens if you're running from a tiger, or if you have, that list that I showed you, you have 3 or 4 of those things all going on at once. So when we look at our brain, what happens to our brain? So I just love to chat and introduce people to a couple of different functions of our brain, because then I think it makes everything kind of fall into place when we think about how our brain works, how mood works, and how we react to things. And also why we have this hard time with attention and concentration and learning when we're in times of stress or mood dysregulation, high anxiety. when we're experiencing symptoms of mental health. So I tell this story as an example of how our brain works. So usually if I'm doing this presentation in person, I will ask people in the room who has been a teenager or has a teenager. And hopefully everybody will say that they have. And essentially, what did we always tell our teenagers or were told to us when we were a teenager, when we made some dumb decision, was what were you thinking, right? Like, why did you make that decision? Why did you do that? Well, our frontal lobe isn't fully developed until we're 25 years old. And our frontal lobe is the executive part of our brain. This is like the good CEO of the corporation that's doing all the good things for the community and is in the black and is functioning really, really well. But that CEO is in training until you're 25. So when I was 21, my friend and I decided for Valentine's Day, because we didn't have a date, we were going to go downtown and we were going to jump on a boxcar train and ride it to wherever it took us. So like Idaho, Wyoming, I don't know. We didn't really think that far in advance. So of course, what is the first thing that you want to say? What were you thinking, right? Well, I wasn't thinking. I didn't have my full frontal lobe working. So we get downtown, we jump on this train. That part of the plan goes off just fine. But as trains speed up, which I didn't know, they jerk each other. And they jerk each other because, they're not connected. They have this like system where they're connected by like a ball, and I don't even know what this is. I'm still not a trained engineer. But what happened is that when it jerked the boxcar I was on, I fell in between the two cars. Luckily, my friend was able to catch me and I was able to grab my hand. But coming to our brain, what was happening? Okay, first I made a bad decision because I didn't have a full frontal lobe. Second, there's a part in our brain called the amygdala. So the amygdala in our brain is essentially the like guard gate. So think about if you drive into a gated community, there's a guard. If you go into some businesses, there's a security guard. Essentially, this person is monitoring the neighborhood, the business, to see if there's any threat. And that's what our amygdala does. I call her Amy. Amy is watching out for our body. So at this point in my story, all systems went on emergency alert because clearly I was in life-threatening danger. So all those things I showed you happened to your body, your GI system's shutting down, my eyes dilating, I started sweating, and my heart started racing. Well, at this point, the brain is like, we are in a state of stress. We have to shut down all non-emergency systems. So now I'm going to have a hard time concentrating. I'm not going to be learning anything. I'm not going to be bringing out my memories to share in this moment, right? Luckily, I was able to get back on the train. But the back of your head, it has your hippocampus. So the hippocampus, I like to think of this as like a little hippo with librarian glasses on, because this is where we store our memories. This is where we get our word finding. This is where we get concentration, even empathy. Those shut down when you're in stress. That's why it's hard to focus or concentrate. Thankfully, I'm here to tell this story. We were able to get off the train, but it is a great example of what happens when we're not working with our frontal lobe, when our system goes on alert, and what happens that way. So the other thing is, I said our frontal lobe doesn't fully develop until we're 25, but that also goes offline in times of high stress, high stakes, emergency situations. So you can see how this is impacting our mental health. And this can lead to poor sleep. This can lead to poor nutrition and, of course, nutritional distress. So I thought it would be good just to go over what like our most common mood disorders. So think major depressive disorder and generalized anxiety disorder. And the idea is, okay, can I recognize this in myself, a loved one, or a coworker? So again, this idea of, okay, let's just be able to recognize it. Then we'll talk about how to speak to it and then resources that are available. So somebody struggling with mood or major depressive disorder, all the things that we talked about make all of this make more sense. So you can clearly have a sad mood, but a more irritable mood. You get these changes in sleep, appetite, and energy. Now you guys all know why. Difficulty thinking, that's all offline. We just essentially become slowed down. And we have a lack of interest or pleasure in activities that we once enjoyed, feeling guilty or overwhelmed or worthless, hopeless. Like it's never going to get better, nothing's ever going to change. And then the physical manifestations that we talked about. And sometimes this can get so bad that we have thoughts of, you know what, it just would be better if I wasn't here, or I'm a burden and it would be better for others if I'm not around. And then for generalized anxiety disorder, you have this difficulty controlling worry. So most of us worry, but it's the idea that it continues to go on and on and on. It's like rumination, and you can't control it. So it's impacting how you sleep. It's impacting how you function at work. It's impacting how you function with your community, or doing the things that you love. And we think about depression as slowed down. Generalized anxiety disorder, I always say it's like a cat in a bath. Like, I mean, you're just really on edge and keyed up. And we still have the same changes in our brain, whether we're anxious or our mood is down. Again, those changes that I was talking about in your brain, your amygdala is on high alert. It shuts off the frontal lobe and your hippocampus. So this is why you have that difficulty concentrating or your mind going blank. Your hippocampus, your little hippo librarian that I shared in this story, is, checked out at this moment. We're more tired, and I already talked about irritability, and then we get physical manifestations and muscle tension, and then all of this impacts our sleep. Then when I was saying that sometimes it can become so bad or unmanaged that we have these thoughts of, it would be better to not be here. So if you hear somebody or you're doing some of these things, these would be warning signs that somebody is having thoughts of suicide. And I mean, this would be talking or writing about death, dying, or suicide, saying things like I said, you know what, it'd be better if I wasn't here. Everybody else would be better off without me. I'm going to take my life. Some people will say that. It will be as blatant as that. But others, we can just see changes in mood. And again, we see the changes in sleep. We see changes in appetite, being more agitated or aggressive, and somebody who's never been like that before. And when you hear people that have survived suicide, they will tell you that I didn't want to die. It wasn't that. It was that I felt either I had no purpose, no sense for living, or that they were trapped and there was no other way out. The reason why I, really like to talk about the brain and how it works is because when you understand how all of this functions together, and then you hear somebody saying, I feel trapped and there was no way out. And for you not being in that situation, you would think, well, there's all these ways out. You have to remember our frontal lobe has now gone offline. And again, this can happen when we don't sleep well multiple nights in a row, or we aren't coping with our stress well. That frontal lobe just goes offline and you don't make rational decisions or thoughts. So this becomes my only option. And we know that that's not true. And then substance use disorder. So this is the fourth one that I wanted to talk about in terms of like most common what we're seeing in the mental health space. So major depressive disorder, generalized anxiety disorder, suicide, and then substance use. So during the pandemic, what we saw is that people Maybe let's say an individual would drink 1 glass of wine 2 nights a week with dinner. And that trend started to change. So for somebody, instead of being 2 nights, it would be 3 nights. And instead of 1 glass, it was 2 or 3 glasses. And we just kind of saw this steady increase. However, when the pandemic ended, we're not seeing a decrease. And that's likely for a number of reasons. But the other thing, when you're thinking about mental health awareness and when I'm potentially looking for risk factors in myself or for other people, it's interesting to know how demographics change that too. So we're definitely seeing an increase in substance use in midlife to older life in women more than we've ever seen before. So much so that we're seeing an increase in their overall mortality. And that's never happened, this steady increase that we're seeing in women right now. And then what we're seeing in a younger population, so think millennials, Gen Z, is that instead of, there's more of a non-alcohol movement, but we're seeing more use with other substances. So whether that's marijuana or something else. So just something to consider within yourself or with other people. So what would be things that we would want to watch out for and if we were worried about a substance use disorder? So this would be taking substances in larger amounts for longer than you're meant to, wanting to stop or cut down, but not being able to manage that, spending a lot of time focused on using that substance, more time getting the substance or recovering from it, having cravings, not managing work, home, or school secondary to substance use, continuing the use even though there have been negative consequences, and starting to withdraw from social, occupational, recreational activities, and continuing this behavior over and over again, even when it puts somebody in danger. Also knowing you are going to have a physiological response from that could make you feel sick, or has made you feel bad, and needing to have more of the substance to get the same effect. And then when you're discontinuing it, having withdrawal symptoms. So I really like this infographic because there are so many things that we can do for our mental and physical health. So our former Surgeon General said there's no health without mental health. So this idea, we really start with this brain top-down approach. And when I'm talking to people in the hospital or in clinic, usually they're always seeing me on their worst day, especially when I was an inpatient provider at the University of Utah's Neuropsychiatric Institute. People were meeting me when they had attempted to take their life. They were having a mental health crisis. They weren't safe to be at home. That was really their worst day. And a lot of times people feel like, what am I going to do about this? Again, this idea of feeling very hopeless and trapped. But we have this whole continuum of tools that we can use that help us mentally and physically. So for some people, we could use physical activity and nutrition and sleep, and they might not need therapy and medications. But for other people, we still need physical activity, nutrition, sleep, community, but we also need therapy and we also need medications. That's different for everybody, but knowing that when we use all of these things together, that's when we see the best outcome. Also, when we're doing this preventively, so if you're here and listening to this and you're thinking about yourself and you don't have a diagnosis of mental health condition, knowing that you can help be preventative, because everybody's going to have stress in their lives, to keep your brain health optimal using these things. Also, when we're approaching maybe a coworker or a loved one, having an idea of, okay, I've got all sorts of resources that I can talk to them about, because some people may be really resistant to medication or resistant to therapy. Okay, well, where are you? Is this not a crisis? Where can we get you engaged in maybe your community, or if you're having difficulty sleeping, whatever that looks like. So being able to use all of these tools. And we want to think about the rule of the cow. So mental health looks different to everybody. And one of the best stories that, well, I mean, it's a true story, it's not a fable, that I've heard that's an example to this was when SSRIs, so SSRIs are first line medication for major depressive disorder and generalized anxiety disorder. They were being introduced in Cambodia. And so they had psychiatrists from South Africa go to Cambodia to help the Cambodian psychiatrists prescribe the medication, know how to titrate them, deal with side effects. And when they met with the Cambodian psychiatrist, he said, "Well, we already have antidepressants." And the African psychiatrists were saying, "Okay, tell me a little bit more about that." So he tells this story. The Cambodian doctor said, "Well, I have a patient, and he was working out in the rice fields. And when he was working in the rice fields, sadly, he had stepped on a device and he lost his leg. And so what happened is that he, one, had to go into rehabilitation. He was able to get a prosthetic. And when he returned back to the rice fields after a time of healing, it was really wet in the rice fields and he was sweating. And so it would make his leg get infections and wounds, and it was really uncomfortable for him. So he couldn't do that anymore. He ended up just basically getting into bed and staying in bed. So his mood changed. He became very tired. Everything slowed down. He disengaged from his community. So all the things that we were talking about, changes in sleep, changes in appetite, he stopped eating. This was all textbook for major depressive disorder. So his doctor went and saw him. They gave him a cow. He ended up becoming a dairy farmer because that was easier on his leg. He then had purpose. He had a way to provide for his family. And he no longer had depression. So, of course, the moral of the story is not, well, we need to give everybody a cow. But for him, it was the loss of his purpose and being able to provide for his family, his interaction in his community. That's what was impacting him so much. So that's why when we look at this continuum of what are all of the things that we're doing in our community, in our environment, and how are we using conventional and complementary approaches to make us healthy, happy individuals, it's really important to look at the big picture. So this kind of goes over some of the things that we should be focusing on. It's kind of similar, but just to give an example, movement. We know that movement is incredibly powerful in terms of our mood. And to give you just a couple of brief examples of this, the largest study that we have on mental health and exercise just recently, within the past year or so, came out of Australia. And essentially what it showed us is it didn't matter if you were male, female, if you were 13 or 83, your sex, moving your body improved your brain health. And we have seen studies where they have prescribed one group an antidepressant and another group exercise, and both did just as well. Now, I do want to say this, I prescribe medication all the time. We most certainly don't want to demonize medications. I'm so grateful that we have Western medicine. The idea is, again, being very individual. For some people, they can have significant side effects to medication or not want to use medication, or medication is providing maybe 25 or 40% of improvement, but there's still a little bit more. So again, this idea, using all of these approaches together. Sleep. We know that if people are sleeping 8 hours a night, if you were to give them a clinically validated test to see if they were depressed, when you start sleeping, you get an average improvement of around 6 points. It's actually double of what we see in medications. So for some people, that might be enough to just get sleep. Some people, maybe we could do sleep and medications. We most certainly know that support, so our social network, we right now are experiencing a loneliness epidemic. So our current Surgeon General has put out a paper for this. And essentially in the paper, what they review is all of the mental and physical effects that we're seeing from this. And it has shown that being socially disconnected is worse for your health than smoking 15 cigarettes a day. So most certainly, these are some of the things that we need to be thinking about. And these are resources to be able to help ourselves, to help coworkers, to help loved ones. How are you doing? How are you sleeping? Are you seeing your community? Are you engaged in your hobbies? What kinds of things do you like to do? I love to be in the mountains with my family, with my dog and my husband. If I stopped doing that, one, that would be very negative for me in terms of my mental health, but two, that would mean something's really wrong. So noticing people's behaviors can also be signs as well. Am I doing meditation or breath work, which we know is really powerful? So these are, when we're thinking about resources helping some people, these are self-help and coping strategies, which again are really important. But then when we think about, okay, maybe this is beyond focusing on some self-help right now, or we need to do that in conjunction with a professional. So having this conversation with somebody, which we'll talk about what that can look like, gosh, I've noticed that you seem to appear more sad than I've noticed in the past, and this seems to be going on consistently. I'm worried about you. There are professionals who can help with this. So we have doctors, psychologists, social workers, counselors, therapists. I mean, there are so many. A couple that I want to call out because I think it's helpful when you are maybe considering getting help yourself or helping somebody else. When we think of doctors, we think, sure, if you get a cold, you break your leg, you have diabetes, you go to the doctor. But one thing to consider is, let's say you noticed one of your coworkers had changes in their mood, you were concerned about them, but you knew that they would be very hesitant to see a therapist. Maybe this like old thought of, it's a shrink, I'm not going to see that, there's nothing wrong with me, pull myself up by my bootstraps, whatever, some of that old stigma we have around seeing therapists. Or it couldn't be old stigma. It could just be, that seems really uncomfortable and I don't feel comfortable doing that right now. Another good way to approach and help somebody into a resource would be, hey, I know sometimes if you have hormone levels that are off. So think about thyroid conditions or women going through perimenopause, we see changes in our hormones. That we know impacts our mood. Or if we have vitamin deficiencies, especially if somebody isn't eating well, being able to use that is this entryway into, gosh, you know what? Maybe you could go see your doctor and get some blood work done. What that does is maybe there's some more buy-in there that can get somebody into a professional. Most, if not all, doctors' offices now, when you go in, there's usually 2 questions that you will answer on your like little intake sheet. And it will ask if you've been more depressed than usual and if you've had thoughts of death or dying. It's a PHQ-2. And essentially what this is doing is it's screening somebody if we need to take a bit of a deeper dive. So you're getting somebody in for screening and seeing a professional who then may recommend therapy or medications. And again, the whole idea is you're not going to diagnose or treat this. This is a resource for you to get somebody some professional help. And then, of course, therapists. But then also, okay, maybe somebody's mood has changed because a family member has cancer, or maybe they have some sort of illness that's impacting their life. Are there support groups that you could recommend? So we know at Huntsman Cancer Institute that they do support groups for that. That would be another area to get somebody in to help. Substance use, of course, we want to think about inpatient, outpatient. We'll talk about some specific resources. But again, just thinking, okay, what's happening? What are we recognizing in somebody? Are we using self-help and coping strategies? Are we using professionals? Are we using a combination of both? And we have lots of options. So, okay, we talked about signs and symptoms. We've talked about strategies that we can take, but how do you start that conversation with an individual that you might be worried about? That is a little bit more difficult, right? Especially if you're not a trained clinician, it can be very anxiety provoking. Here's the one thing that I want to stress is that it's okay to ask people how they're feeling. I mean, we do this all the time. Hey, how are you doing? What's going on? So this idea of just checking in with somebody, that's fine. And I want to take the stress off of feeling like I have to know the next thing to say or the next thing to say. Really, the best tool we have is to close our mouth and to open our ears and just listen and then provide reflective feedback, meaning that we are just rephrasing what they've said to us and how we've heard that. Because most of the people that I talk to or I do trainings with say, I'm afraid I'm going to say the wrong thing, or I won't know what to say, or I won't be therapeutic. That 100% isn't your role. Your role is just to listen, reflect back what they said. So thinking of, gosh, that sounds hard to manage. I'm sorry, things are really difficult right now. And then, oh, you know what? I know of this resource, or have you considered doing this, or using one of the things that we were talking about. And you can use the QR code here for a step-by-step guide to start a conversation. But starters, hey, are you okay? I've noticed that. How are you really? Would you like to take a walk and have a talk? So if somebody does open up to you, again, more mouth closed, more ears open, and then, gosh, you know, I'm sorry, that sounds difficult. Have you thought of maybe doing X? And then specific to suicide risk assessment, there's a logarithm really to follow here. So again, this idea, checking in with somebody, assessing it, asking the question, it is okay to ask, are you thinking of harming yourself? Are you thinking of killing yourself? Are you thinking about suicide? If somebody says yes, okay, have you thought about a plan and how you would do it? And do you have the means to do it? If somebody's having thoughts of hurting themselves, has a plan, and has means, this is a 911 emergency situation right now. And that makes a lot of people nervous. Like, what if that person gets mad at me? My answer is, oh, I'm so happy they're mad at you because that means that they're still alive to be mad at you. That is our highest risk if we have a plan and we have the means to do it. Now, there are times where things can get pretty rough for someone, and they may have the thoughts of it would be better off to not be here. However, they have no plan, they have no means to do it, they're just experiencing these thoughts. This is not necessarily a 911 situation. This is a situation, though, like we should probably call 988, the mental health crisis line, make sure that they're connected with supportive resources. So whether that's they have a therapist, they're getting a therapist, we're contacting the EAP to get some support, potentially going and talking to HR if they're open to that. Maybe we need some time off of work. Is family involved? What are we doing? And this is definitely, we need a professional intervention here. So I have this little logarithm that you can follow, and it's easy because it's CARES, which that makes sense, right? So when you think about CARES, you're thinking about compassionate listening, which we talked about. It's very in line with meditation, mindfulness, just being present without judgment. Assessing for the risk. So we went over to assess the risk for self-harm. And then reassuring. So again, this idea of repeating back, this seems very hard. I don't have to treat this, so let me link you to some resources. And empowering people. So we have the empowerment through self-care that we talked about. We have that through professional system, through professional resources. And then what is their support system? So does somebody have a support system and how can they be engaged? So here are some things when we're thinking about the signs, and we've talked about this, but this is just kind of a nice slide to summarize this. But what would you see in somebody that was experiencing some early signs and symptoms? So we haven't moved to emergency quite yet. This is early signs and symptoms. So this could be, and we can look at this like in the workplace. So consistently arriving late or canceling personal or work-related obligations, looking visibly tired and drained. Maybe their appearance has changed. So they're tired, they looked unkempt or disheveled. This loss of interest we talked about, experiencing emotional states that seem unhappy, feeling sorrow, anxiety, struggling with focus, which you guys now know very well why we struggle with our focus. So we can see this change in work, the quality of work, and then being indecisive, difficulty making decisions. And then basically what we'll see as it worsens is that we just take all of those things and we take it up a level. Just everything starts to get even worse. So maybe we're just not coming into work at days at a time. Maybe we're not completing our assignments at all. Maybe we're becoming very unkept. We can also, if somebody starts self-harming, we can see bruises or cuts that are healing at different stages, and just being completely overwhelmed at all times. And then again, change in our mood. So we can be very angry, the worry, we can see changes in body perception, these racing thoughts, and then just this heightened level of self-criticism and self-blame. So I just wanted to go over a little case example. So Sarah, who's a close colleague of Mark, notices a change in his demeanor and personal hygiene. Mark used to be cheerful and engaged, but now he withdraws during lunch breaks and avoids social interactions. Mark mentions in passing that he has not been sleeping well and appears fatigued. Sarah approaches Mark gently, expressing concern, and Mark confides that he is battling with depression due to his personal issues. So we're seeing some of those early warning signs, right? So the emotion has changed. He's avoiding lunch breaks with colleagues. Sarah's noticed that Mark's more fatigued, and he also verbalized that he's not sleeping as well. He's neglected his self-care, and he tells her he's struggling. These are early warning signs. We're not seeing anything that's emergent right now, but definitely we need to pay attention. So Sarah tries to provide some support, but despite that, Mark's depression worsens. He calls in sick frequently and continues to struggle to concentrate at work. So Sarah suggests he speak to the company's EAP program. Mark appreciates her concern, but feels overwhelmed. So one day, Sarah finds Mark crying in the break room. She sits with him, assuring him that seeking help is a sign of strength. And together they reach out to the EAP counselor and explore coping strategies. So what I like about this example is that we noticed that Mark was struggling and Sarah was providing some support. Now, this is like a brief example. Maybe that support before it had gotten worse, she was talking about some of those self-care coping strategies, but that didn't work. And this is escalated to getting even worse. We need a therapist. We need some professional help. Let's call the EAP together. The reason why I like this example about calling together and what you can see, and like she suggests calling the EAP, but Mark's just completely overwhelmed. This is a really good everyday example of when we're thinking about utilizing our resource, and in this example, an EAP, is that sometimes when we give people resources, it's kind of like I say, giving Skittles to somebody who's been in a major car accident. I mean, what are those Skittles going to do? Our brain, which again, this is why I highlight what happens to our brain, it just goes offline. So when our frontal lobe's not working, it is hard to, okay, I've got to call this number, to talk to a stranger, to make an appointment, to schedule this. Well, this is probably not going to go well when I'm not even showing up to work. However, if I have somebody that's willing to take 5 or 10 minutes and sit with me in another room, call together, get this scheduled together, that's a very different outcome. So if we look, I'm just trying to make sure we're okay. So Jason, this is a different example. Jason, the department manager, has observed significant change in Alex, one of his team members. Previously, Alex was punctual, efficient, friendly. However, lately, Alex has been avoiding social interactions with colleagues, missing work on most Mondays. So this is something to note, missing work on most Mondays. Oops. Arriving late on other days, smelling of alcohol, and struggling to focus during meetings. Jason notices Alex's clothes seem to be much bigger, as if he's lost a significant amount of weight. And during a private conversation, Jason learns that Alex is experiencing financial stress and using alcohol as a coping mechanism. So as we can see, there's clear worry. Somebody who may be misusing or abusing substances, we will see that this is a common behavior, is that people will miss the day after payday or miss Mondays. That would be if somebody was working like a typical Monday to Friday. So whatever their Monday would be, missing that day because they're recovering from their days off, or when they get paid, maybe using more at that time. And we could see that I went over some of the physical changes you're seeing, the change in work performance, social withdrawal. So just to highlight, and I talked about this a little bit about substance use disorder, in a workplace, you can estimate about 10% of the workplace will struggle with a substance use disorder. And we know 70% of individuals with substance use disorder continue to maintain employment. So this is happening in workplaces. However, only 1 in 11 people will utilize or have access to substance use treatment. So this is a pretty big problem. I'm going to skip this one for our time. So I was talking about this, the continuum of mental health, where we're struggling and disengaged to thriving and engaged. Okay, so let's dive into resources that you can suggest. You know now how to recognize it, how to speak to it, where we have options. So everything from coping skills to professional help. Okay, let's look at some of the things, tangential takeaways that we can look at. So Mental Health America is a fantastic resource, but one of the resources I really like here is if you were having a discussion with maybe yourself, a family member, a coworker, and they were open to talking about this, but were kind of unsure, you can go to Mental Health America and take a mental health test. So this is depression, postpartum, anxiety, there's addiction, there's many here, just to say, oh, I've noticed X, and open this conversation. Well, maybe we should look at this and see what this looks like. Let's look at a professional organization and be able to look at that. There's even a self-injury survey as well. So that's one resource. 988, this is a perfect, okay, if I have one thing in my back pocket, this is it. So 988 is the National Suicide and Crisis Lifeline. What I do want to say about this is that you don't have to be in crisis to call this phone number. You can still call if you are having, or a coworker or a friend is having worsening mental health, to get hooked into some resources. But it's 24/7. It's confidential. Anybody can call at any time. And when you call in, there are 3 options. It will see if you're local, because it will route you to local resources, if you're a veteran, and if you speak Spanish. So there's Spanish option as well. So this is a perfect overall, and especially if you're seeing a crisis, this is a good resource. And then therapy. So if you were to talk to somebody about starting therapy and needed some tools to be able to say, oh, you know what? Therapy is not just for X. It can be for all of these reasons. So somebody might be more anxious than normal, have higher stress in a certain season of time, and that could be good stress too. moving to a new house, getting married, having a baby. These are some of the biggest life events that we have and want, but it does increase stress. So we don't just have to go to a therapist when things are bad. We might just need some extra support to be able to process big life events. Also, what if you have something that's going on that you don't want to talk to somebody in your community about? You would like somebody who's not involved, a third party, somebody who has no judgment. That's another reason to talk to a therapist. Processing trauma. Since we now talked about the amygdala, this part that's high alert, that we can be very anxious. If somebody grew up in a traumatic household, your amygdala can physically grow bigger. We also know that doing meditation and mindfulness can decrease your amygdala, which is very cool self-coping skill, but we may need help processing traumatic events. And then, of course, common mental health conditions. So I talked about EAP, but always thinking about somebody within your organization, somebody else's organization. Most companies have an EAP, but essentially this is no cost. This is free, and everybody will have different different amounts of sessions. But the thing that I wanted you to know is that this is per event. So if you have like 3 or 6 sessions, we'll just take 3. That would be, okay, I'm getting married. I'd like a little bit of support to process all of these emotions I'm having. I'm going to see somebody for that through the EAP. So you see them for 3 sessions, everything's great, we move on. Okay, what about in 6 months down the road, my new marriage, we're having some financial concerns, I'm feeling some stress about that. That's another new 3 visits, because it's a separate event. So it's not necessarily for the whole year. And then there are other supports too, like childcare, crisis childcare, elder care. EAPs can provide different options there, sometimes financial and legal too. And then, okay, so let's say we used an EAP, but we need more support. We're going to look for a therapist. I always say finding a therapist is somewhat like finding your favorite swimsuit or jeans. You sometimes have to try on a few. You can go to psychologytoday.com, and it has a fantastic filter. So you put in your location, your insurance, your cash pay, your self-pay, if you would rather see a male or a female, what types of therapy they specialize in. And then it gives a picture of the person and a little bio. I feel like that's really helpful because, okay, I can see that I would probably maybe connect with this person. Like I see their picture, I feel comfortable with them, I read their bio, that speaks to me. I think there's just one more tool to make it a more successful treatment strategy. And so you could do this for yourself, or maybe you sit down with a coworker or a loved one. Hey, let's just look at who's in the area. Let's read some bios. Mantherapy.org. This is a fantastic resource just to like, it kind of makes you smile when you go to this website. This is a fantastic resource when we're looking at men. You can have your man therapy. So I like this. It's okay to cry even when it's not about sports. And then here local in Salt Lake, we have MCOT, which is the Mobile Crisis Outreach Team, which many of you I likely will be familiar with. But I talked about 988 being our crisis line. Also, there's the warm line. So if you're not in crisis, you just want to talk to somebody, we have this available to us too, through a toll-free line or a local line. Also, the Mobile Crisis Outreach Team, if you were to call them because somebody was experiencing a mental health condition and couldn't get to the university or get to a location and they were in crisis, they will come out to you. Social workers will come out to you. So reaching out and contacting them is a fantastic resource. And this actually just happened last week with one of my neighbors, and MCOT came out and provided great support, and now he is getting treatment. And then we have our National Alliance on Mental Health. So this is kind of just a resource when you're thinking about training, support groups. Of course, our local mental health authority, 211 Utah. This is great for resources. So they have resource lists for everything for a divorce attorney, food pantries, therapy, elder care. It is just a whole list of, and you can call the phone number too and say, hey, this is what I'm going through, or this is what somebody else is experiencing. What resources do you have? So I say 988 and 211. Put those in your back pocket. And then the American Foundation for Suicide Prevention. SAMHSA is our substance abuse and mental health services. So this one I just wanted to highlight. If somebody would like to look for treatment for a substance use condition, you can go here and find the locator, put in your address, and be able to filter places to get help for IOP, residential, intensive outpatient. And this is what it is, findtreatment.gov, and it's run through SAMHSA. And then just quickly, when we're thinking about substance use, there are lots of options in terms of support. So in the rooms, Faces of Recovery, they do online AA groups or AA style groups. So if somebody can't leave work or their house because they have kids at home, they can go in another room and still go to group or still go to a group. And then USARA, this is a fantastic, all of these are fantastic. USARA is a Utah Support Advocates for Recovery. They play sober softball. They have community events. So this idea of using community peer support as being an effective evidence-based tool for those that are challenged with substance use disorder. And then for people that have somebody in the family or a loved one or a close one that is experiencing a substance use disorder, I cannot stress enough how this impacts loved ones. It impacts loved ones in such a dynamic, individual way. And I think so much we focus on our loved one that may be struggling, and we need to focus on ourselves. So Al-Anon is group support for those that have a member struggling with substance use. So please explore this option if that speaks to you. And then Live On Utah. So Live On Utah is a resource for suicide prevention. But this would be my invitation to individuals here and as a group, is that if this, like, you're like, oh, I really, this speaks to me, suicide prevention, I want to be part of this. You can go to their Instagram and go through their 10 modules. It takes about an hour to go through all 10. And once you do that, you become a Live On ambassador. Now, if Salt Lake County wanted to become, as an organization, a Live On ambassador, you need to have 80% of the workforce go through that. And I think that that's such a neat thing to do as an organization, clearly as an individual, but also as an organization. And then, oh, whoops, sorry. A website, Live Through This. This is a website that goes through individuals' lived example through mental health. So it's very humanizing to see. It doesn't matter what you look like, how old you are, we're all going through this, and you can read stories of people that struggled with their mental health and may have thought of harming themselves, or they're survivors. And it's very humanizing to go through. And I think this is our last one. Sorry, we're a little going over a few minutes. The Trevor Project. This is an organization that's focused on suicide prevention for LGBTQ youth. So, again, in our family systems, in our community, it's not that just the person is affected, it also affects others around them. So being able to have support for, you might have a coworker whose child is struggling, and being able to have a resource for that, or you have a child. This is a great in terms of LGBTQ youth. And so they have a chat, they provide suicide prevention services, online support. So check this out if that speaks to you. Okay, there is a lot to fit into that. So hopefully everybody got one thing from that, and I'm happy to answer any questions. I'm going to stop talking now.
Thank you so much, Catherine. Really appreciate you going through the physical and mental health link and the resources and then even behaviors to look out for with our loved ones and coworkers. That's going to be so helpful and getting people the resources that they need. So I really appreciate that.
Thanks for having me.
Of course, yes. And we'll have you back on Monday. We'll be talking about nurturing mental health in the workplace. This will be targeted towards our leaders in the organization. So we will send out marketing for that. So get your supervisors and managers and leaders all signed up for that so that they can provide mental health that and break down the stigma of mental health as well in our workplace. But I really wanted to highlight, I put in the chat our EAP services. It is available to all county employees and their loved ones. And it's just a great resource for mental health maintenance and also for people who are going through a little bit of a harder time. So download that app and get started with it and then know that it's there when or if you ever need it. But thank you again, Catherine.
Thanks.
And I know you have a busy day, Catherine, with more presentations. So we'll let you go and I'll stay on if anyone has any questions.
I'm happy to stay for a couple minutes if anybody has any questions for me.
We've got lots of thank yous in the